I want us to look at a blood donor, which is now our second lesson. I'll look at it in two parts. That is lesson 2A and lesson 2B. So for the objectives of this part A, by the end of this lesson, a learner should be able to define who is a blood donor, outline blood donor selection and recruitment criteria, and also be able to discuss the collection of blood from a blood donor procedure. And I'll start with this introduction here, that a blood donor is a person who gives blood for transfusion. And I know probably each of us or most of us have given blood before for transfusion, or have interacted with blood that has been given for transfusion as we work. And it is important for us to donate blood because usually there is no substitute for blood. If there is blood loss in accidents or in certain medical procedures, then we need the blood to be substituted with blood. Then in every 3 seconds, usually someone needs a blood transfusion because obviously of situations of emergencies such as accidents, also surgery procedures, and also in situations where people are suffering from maybe blood cancers. And then your donation, of course, will help save a life up to 3 people. And blood is the most precious gift because you give the gift of life if you donate blood. And then out of every 4 of us, somehow we will need blood in our lifetime, and only 5% of eligible population donates blood in a given year around the world. So essentially, even as we are medical people, it is important that we do give blood. So we have different types of blood donors, and one of them is what we call voluntary donors, and they donate blood on their own. We don't have any coercion. They just decide to give blood for the sake of, having blood available for people who may need it. Then we have replacement donors from within a patient's own family or community. So maybe you have a hospitalized a relative or friend, and therefore you choose to give yourself as a replacement donor for them to have blood. And then we have autologous blood donor, and here is where a patient donates blood for their own or for themselves. Maybe the condition they are suffering from does not affect their blood, and therefore they can be able to give, and that blood can be used for their therapy. Then we have apheresis donors. These ones donate blood components through a process called cell separation, and usually this is a specialized machine that is only able to pick the blood component of choice. Maybe it's the platelets, maybe it is the red blood cells, and so on. Now we have various policies and guidelines when it comes to blood donation, and we have what we call, I have put it in 5, that is donor recruitment, donor retention, donor selection, donor collection, and donor counseling. So we start with blood donor recruitment, and in this is a strategic goal that ensures effective mobilization, recruitment, and also care of voluntary and non-remunerated repeating blood donors to ensure that there is always a consistent and enough supply of safe blood for transfusion. So a donor recruitment program usually will ensure that we have adequate supply of low-risk donors or people who can easily give blood without any complications. And every laboratory will require to have a blood donor recruitment program of how they sign up blood donors who are voluntary, so that there is always safe blood, because we cannot rely on like family and friends in situations of disease all the time. We have to have enough supply of blood by recruiting voluntary donors. And of course, we have to have a dedicated recruitment section that has trained staff, laboratory technologists, laboratory specialists, or laboratory scientists. So some of the strategies that can be used for blood donor recruitment is, for example, having blood drive flyers. So we create a blood drive and do flyers for advertising. When will it be, at what time, and who can be contacted for the drive. We can also do social media marketing. We can also establish, calling and texting certain people individually. Maybe they have donated before, so we reach to them again. And then we can send also emails or with the information of the blood drive, and also how people can sign up. And then of course recirculate or circulate sign up sheets, or have a table in traffic areas, or maybe hotels, or within common areas in the major towns and cities, cafeterias, etc., so that we can have people sign up, and then we can after that follow them up with emails or texts or calls, so that they can turn up for blood drives. And of course, have blood donation booths regularly. We can now even establish not just a sign up booth, have the donation booth within a place where there is high traffic, as well as, of course, have them in hospitals and also even in blood transfusion centers. Then we have what we call donor retention. Now you have recruited voluntary donors, but now how do you retain them, or how do you ensure that at least those that you have already gotten, especially if throughout the selection criteria, as we will be looking, they have qualified, how can you retain them even for future? Because we can donate blood more than once within the year. So blood donors will only return if they receive a favorable impression of the service, of course, and therefore it is important to impress them the first time they come, make them feel comfortable. Of course, also follow them up through a text message, thank them. And if they are deferred temporarily, for example, maybe they came as they were signing up, then they couldn't give blood for a certain reason that may not be permanent, then it is important to indicate when they can come back and do the blood donation. Now, the blood donation or blood donor selection criteria is extremely important because it determines the eligibility of a donor to donate blood. Because as much as you have done a recruitment program, as much as you have done a lot of advertising, once now they come, we need to ensure that they are eligible, because we need to ensure that they are both safe and the blood they give is also safe for our recipient. So the selection is criteria is essential, and it is usually based on accepted regional and international practices. So we'll have what we have in Kenya, we'll have what we have in other countries within Africa and across the globe. And also we need to ensure that we protect the donor, so that you choose in a way that ensures it is safe for the donor to donate. Don't just accept because they came, ensure that they are also safe, and finally ensure that we protect the recipient by ensuring there is no risk that we are likely to get when we do the transfusion, and therefore no infection, for example, and no adverse effects, or at least make sure they are minimized, because there is also the other screening that we do in the laboratory for other things that may not have been noticed at this point. So we have pre-donor information that we need to get. Of course, we need to get a lot of documentation that we give to donors for them to understand donation, for them to understand pre and post donation, for them to understand also that there is what we call deferral information, that we can have them defer or not give at that point they have come, maybe based on a medical condition, or also maybe risk behavior, or how maybe you have entered a questionnaire and realized that there is something concerning how they carry out their lives that is risky for the blood that we get. So the general criteria that has been adopted here and in many parts of the world is that in terms of age and gender, we must have people being 18 years and above. The minimum age for blood donation is 18 years. And between 18 and 60 years of age, you can be able to donate all types of blood. All types of blood donations are allowed, except if you want to donate granulocytes, and that you must at least be before 50 years. You can't do granulocytes for 60 years because these are white cells that are involved in immunity. So the older you get, of course, the less the quality. Then in terms of donation intervals, between the first time you give and the second time you give, we have certain minimum intervals that should be there. So if you give whole blood donation, then within 8 weeks, that is around 2 months, then you can come back and give again, and so on and so forth. If you donated platelets, you can actually do another platelet donation within 48 hours, but they must also check to ensure that your RBCs are satisfactory before you can do the next. If they are not satisfactory, then you also wait for 8 weeks or 2 months. And then if you gave a red cell donation, you need to do 16 weeks, especially if you have given 2 units of red cells, then you need to wait for 4 months before you can come back, because of course this definitely lowers your HB. Then donation frequency, how many times now within the year can you do donation? So depending on whether you're a man or a woman, you can do about less than or equal to six units per year for men and 4 units per year for women. And of course, we say the intervals is within 8 weeks. Then if between two apheresis or platelet donations, we had talked about 48 hours, they should be given within a maximum of 2 donations per week. Like, don't do more than 2 donations, even if it's 48 hours, don't do more than 2 donations per week, and up to 24 times per year for both men and women. And if you do plasma donations, then you can do less than or equal to 24 per year for both men and women. The volume that we collect in most cases is usually for whole blood about 500, or what we call 1 pint. And this 500 includes the samples that you collect for screening as well as the anticoagulant. So essentially the blood excluding the anticoagulants and the blood samples is usually about 450 ml. So this is at least maximum of 500 for whole blood. If you are doing platelet you can do a maximum of 650 ml. And if you are doing apheresis for plasma, then you can collect at least a maximum of 700 ml. Now, what is the procedure? We need to confirm. The very first thing, a person has come, maybe it is a blood donation drive and they want to give blood. We need to confirm this biological information. First of all, are they between the ages of 18 and 60? And then in terms of their hemoglobin levels, what are their hemoglobin levels? If they are females, should be at least 12.5 to 16. For males, 13.5 to 18 if they are donating whole blood and plasma. And if they are doing RBC, remember RBC of course definitely lowers your HB, so your HB should at least be 14.0 for males. And then for apheresis of platelets, then your platelet level should be above 150 times 10 to power 9 per liter. Then body temperature need also to be normal. That is, it cannot be more than 37 degrees Celsius, because at least this we are sure you don't have any infection. Then we need to check for the pulse and ensure it is a regular pulse between 50 and 100 per minute. And then blood pressure, of course, the systolic should be between 100 to 180, diastolic 50 to 100. And then body weight also, you could be between 18 to 60 years, but your body weight is less than 50. So it is important to be at least 50 or more for you to donate. So first, confirm the biological information. Next, allow them to fill in their demographic information. Let them write their names, father or husband, especially because of next of kin follow-up in case of anything, date of birth, their age, their gender, and where they live. It is very important, as well as their phone numbers for future follow-up. And then also make sure you conduct a medical interview that gives us their clinical information or history. So the medical interview is a collection of information on health and behavior or for critical assessment of donors regarding fitness. They could be looking fit and everything, but we need to conduct a medical interview. So what to ask and why, you need to maintain confidentiality of the person's information, create a good relationship so that they can trust you to tell you everything. And then personal interviews should not be overheard by anyone else, and then maintain the right of each donor to privacy. So medical examination will also include now the hemoglobin testing and also measuring of weight. And some of the things that you could be asking are you at present in good health? Generally ask them if they are in good health, and then when did they eat last? Because if they haven't eaten, then there could be issues when they donate blood, which we do not want. And then, are you taking any medications? Which ones? Have you been vaccinated recently? Which vaccinations? Have you suffered from a convulsion or any mental disorder before? Have you ever had jaundice? And maybe you'll also ask, have you lost significant weight in the last 6 months? And of course, in such a situation, we need a medical doctor to do the examination so that we can get some valuable conclusions. Now, we need to exclude individuals who may have a cough, influenza, or sore throat, common cold at the time they are doing blood donation. And then we should not also have donors who have taken any antibiotics or any other medications in the past 48 hours. Then if anyone has also taken any alcoholic beverages in the past 24 hours, you should exclude them. Exclude pregnant and breastfeeding mothers, or those who may be in their menstrual cycles because of course of lowered or loss of blood that could now implicate them if they give more blood, and have maybe somebody who has donated blood in the past 3 months. You need to reevaluate them well to ensure that they are doing okay before they can give again. And then anyone who's been treated in the past 1 year for rabies, treated for malaria in the past 3 months, or had any immunizations in the last 1 month should also be excluded. And then have had any dental treatment, or they have taken aspirin in the last 72 hours. Maybe those who have terminal illnesses like diabetes, heart disease, high blood pressure, cancer, and blood clotting problems or diseases should also be excluded, as well as people who have diseases such as TB, bronchial asthma, or allergic disorder, liver disease, kidney disease, or have or experience fits or fainting. So those are people we should exclude. Now, there are people who we may not exclude, but we can do what we call temporary defer them, so that they don't give at that particular time, but maybe come in the future. Okay. So if somebody has had a major surgery within the last 6 months, ask them to wait. Minor surgery within 3 months, also ask them to wait. Donated blood within 3 months, they can also be asked to wait, especially depending on how their vitals come out. Tooth extractions or any manipulation of dental, they can also be deferred. Then they have received blood themselves or any blood component transfusion within 1 year, they should be deferred. And then aspirin, if taken within the last 3 days, especially if you're preparing for platelets and other component preparations, they should be deferred. History of malaria, they should also be deferred. And TB for 5 years after complete treatment and cessation of symptoms. And we had mentioned that for such, we need to communicate to them, because you remember we talked about recruitment and retention. Communicate to them when they can come back, so that we also have complete and adequate supply. Now, these are completely or permanently deferred, or they cannot give blood if they have had a history of heart disease, they are on any cardiac medication or cardiac surgery, they are hypertensive, they have endocrine diseases such as diabetes and hyperthyroidism, they have any form of malignancy and cancers, or they are high risk groups. We talked about checking for individuals with certain risk behaviors. Maybe as you investigate someone or as you ask them questions and they fill out questionnaires, you realize that their behavior is risky in terms of HIV infection. Maybe they are alcoholics in one way or another, so there is also likely to be misconduct or a risky behavior in contracting HIV. Also, if they have chronic renal failure, chronic liver disease, um, stomach ulcers, bleeding tendencies, of course, severe allergic disorders like asthma, and they are on medications such as anticoagulants, immunosuppressive, and cardiac medications. Those should be deferred permanently.